There's been a lot of changes at the VA hospitals in North Carolina. Several former directors have moved up through the regional system, and so we have new leadership at each of the hospitals. Paul Cruz recently has been installed as the director at the Durham VA Medical Center. Now, what do you hope to achieve as the director of the VA system here in Durham?
Well, my ultimate priority is to make sure that every veteran gets the highest quality of care that they deserve and that they've earned. But more specifically, I want to make sure, and I'm working with my staff to ensure that we provide safe care, making sure that that care is safe for both our employees especially for the veteran, making sure that it's timely, that we can get our veterans in the right times, making sure that it's effective, so that we're making sure we're doing what we want to do and making sure that it's equal across no matter what point where you come into the VA for us here in the Durham area and out in Morehead City as well in the furthest areas, that those veterans have access to the same levels of care that we do here at the Durham VA Medical Center.
What brought you to this position? What made you decide, yeah, I'll take this job?
Right. Well, a couple of things. I've been in public service for now probably over 30 years, and being a veteran myself, a disabled veteran, I get my care at the VA. And I just wanted to lead a veteran healthcare system and make sure that we provide and ensure that we provide the best care we can for our veterans. As to Durham and North Carolina, I used to live in Nashville, Tennessee, and we used to come out here and vacation all the time. And so it was really a big attraction to us, my wife and myself, and we really look forward to living here and enjoying the area. And I understand it's the best of two worlds. We can have the coast and we can have the mountains, so that's what we're really excited about.
A lot of things people know, there are a lot of good things that are happening at the VA. Right. There's some things that have been known in the past that have happened as well that haven't been as good. How do we move forward and keep the good and improve on the bad? Right.
So one of the biggest things that I want to make sure is that I have great communication with our veterans and our users, as well as with our employees. So we want to make sure, I need to make sure, and I will be doing this, is going out and meeting with veterans groups, meeting with veterans, meeting with the veteran service organizations to make sure we understand where we can improve and what we can do to do that. I have a background in healthcare quality and process improvement, and that's what I focus on, is making sure that we get the care the way it should be and making sure that every veteran is served and get what they need.
I know there's some changes coming up between Fayetteville, the Fayetteville VA and your hospital as well. There's a lot of changes getting ready to happen soon. Is that the progress that we're looking for?
So I think some of that is the progress, right. So I think we're looking at our market to make sure that we can provide the best care for our whole market in the southern, northern North Carolina market. So looking at how we can best help with Fayetteville, help with Womack Army Medical Center down there, and tie that in with our services up here in Durham. It is about how we can provide those resources and making sure that we do that. And, you know, bottom line, another thing is that we want to make sure that we provide personalized healthcare services. I am really looking for a concierge level of healthcare to where our veterans come to expect that level of care and that we're personalized in providing that. And we want to provide that high level of very intense care that we have here at Durham and provide that all the way down throughout our